Welcome to America's Heroes Group.
Welcome back to America's Heroes Group. This time we have a roundtable, our partner. We are globally connected with Kaiser Health News. That's KFF Health News. Today is Saturday, September 16, 2023. September is National Suicide Prevention and Hispanic Heritage Month. I'm Sean Claiborne, the co-host. Our host is Kelley. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of Scotch Arnold Productions. And we have Arthur Allen with us today as a panelist. He's a KFF Health News senior correspondent and writes about the FDA and pharmaceutical industry, as well as COVID-related topics. Arthur has been a freelance writer for the New York Times, Washington Post, the Smithsonian, and the Associated Press. How are you doing today?
I'm great. How are you?
Pretty good. So there's some things that we're going to talk about as far as the new COVID vaccine has come out. So up until now, so correct me if I'm wrong, but if I got the timing wrong or if something is inaccurate what I'm talking about, but up until now, we've had initially in 2020 we had the initial vaccines by Moderna, Pfizer, and Johnson & Johnson. Then in 2021 we had the first booster. That was around the fall. In 2022 around the fall again we had a second booster. Which was the third dose, basically, of the vaccine. And then this year in 2023, we have a fourth round of the vaccine. What's the difference about this new vaccine and this fourth round?
Well, as everybody knows, or if they're paying the slightest bit of attention, unfortunately, this virus has mutated like crazy, and continues to do so. There were periods earlier in the pandemic, in the first year or two, where the mutations were really huge, and they led to bad new outbreaks of disease, deaths, and so on. Now things have calmed down a little bit, but the virus is still mutating, and so the scientists and the drug companies are trying to keep up with the mutations. And every time they release a new vaccine, they basically match it to whatever they think the mutations are going to be that are circulating when it's rolled out. And so in this case, they have a pretty good match. The vaccine that just started rolling out this week contains, one particular mutation, and like 90% of the viruses that are going around now are related to that one closely enough that it should have some impact, positive impact.
And one thing I learned from reading your article is that, and kind of got exposure to, is the fact it seems like there's different. It's not like there's one variant, because we usually hear about one major variant, like it's the Omicron variant, or whatever the other one was, the Kraken variant that came out, last year.
The Delta, the Alpha,
So is this like but it's really many different variants, and so the vaccine, it all depends on the cases that are out there. Like one variant might only affect maybe 5% of the population or 5% of the cases. The other one might be 20%. Another one might be 15%. So it's really a combination of many different variants that these vaccines are trying to address. So why does the CDC recommend this? Well, first, before I get to that question, so the first round we had about how many people in the first round would you say, from your research, if you have this information, got the original dosage? What percentage of the country in say 2020, 29, or maybe early 2021 actually got their first initial vaccines? So you did touch on this a little bit in the article.
When it first came out, as you recall, everybody, there was there wasn't enough for everybody to go around. And so people were, I remember, I think the first vaccine came out in December. I didn't get mine till April because we were all waiting. I think eventually the number, and I should have that right at the tip of my tongue. I think it was 70-80%.
Wow.
Although not so much for kids. So by the time it rolled out for kids, it was lower, and for younger adults too. But I think for adults, it was certainly, I'm going to say it was over 70%.
And then the second round, maybe even higher, maybe?
No, the second round was lower. So the second round, the second round that came out in the fall of 2021, about 50% got vaccinated with that one, 50% of adults. And then the third one, the bivalent, which came out in the fall of 2022, that only 17% of Americans got it. Something like 45% of people over 65 who are, the people who really should be getting this vaccine.
And I'm assuming they maybe got it because they're going to their doctor more frequently, and the doctor is just recommending, and they're getting the flu shot and getting the vaccine because
right.
It's just they're getting more access to health
Right,
care.
right. And I think people are aware that if you're older, I mean, I can't remember the exact numbers, but I believe that 80% of the deaths have been in older people. So there are some other vulnerable groups too. People with chronic illness and immune suppression because they have cancer or other diseases. But, a lot of the deaths are older people.
So that leads me to this question. So the numbers were falling, and 17% seems dramatic from, the first time. So it seems like people are just not, participating at the same level. So why does the CDC recommend this? And then, but also, how does the CDC recommend this vaccine?
I mean, it's really interesting. I mean, there are definitely scientists out there who I spoke to who said we should just recommend this for the vulnerable groups because, I mean, the uptake is so low anyway. And to be frank, like if you're a healthy 35-year-old or 20-year-old or even 10-year-old, the chances that you're going to get gravely ill or die from COVID are really low, especially now that so many people have gotten at least one vaccine, and most of us have also been ill with the disease. And that gives you protection also, assuming that you don't have a really bad experience. But so the but is if they didn't make the recommendation for everybody, then people who feel for one reason or another that they want the vaccine, either because they're in one of these vulnerable groups or they have let's say they have a grandparent who's very ill who they take care of or visit a lot, and they don't want to get sick. So this is a chance to get where everybody, when you make when the CDC issues a recommendation of the type that they issued last week, which is a universal recommendation, that means that insurance companies have to pay for it. And this other program goes into effect where people who don't have insurance can get it for free. If you had a limited recommendation, all that stuff gets more complicated. So if you're a person who doesn't fall into the category of recommended people, you might have trouble getting it. Fact is, they recommended it. I personally think that the vaccine is very safe, and there's only small groups of people who would be hesitant for safety reasons. And, so I think it's worth getting, but there aren't going to be any mandates. That was, you're talking 2 years ago, 3 years ago. So if you don't want to get it, you don't have to get it. And so, but by broadly recommending it, they're letting anybody who does want it get it. And personally, my view is that for most people, it's the right decision.
That makes a lot of sense. And that was kind of confusing me a little bit because I think that's part of the controversy around this still out there. It's not quite dissipated because you still have those hard, fast people that believe that it's some kind of that people die from the vaccine or that people catch COVID from the vaccine, things like that. And people that swear by that they've lost friends to the vaccine, even though those people died of COVID. But much like the flu, the COVID vaccine does not guarantee non-infection. And even if you get the vaccine, you might still get sick. But then also maybe if you don't get sick, you can still pass it on to other people. I think perhaps that was what I think turned a lot of people off because they were under the impression that if I got the vaccine, I'm bulletproof. I can do whatever I want to do, and I'm never going to infect anybody else around me.
Absolutely, yeah. No, you're totally spot on that, and I think that that initial confusion about it, which partly you can attribute to bad communication from the scientists or the government, partly you can attribute to the fact that nobody really knew how well this vaccine was going to work, and so there was kind of a lot of optimism about it, and so a lot of people felt kind of like cheesed off. I mean, either that it was a ripoff by the drug companies, or why bother getting it? I think, and I think in any given case, I could get vaccinated next week, and then a month later get infected. It's possible, right? I mean, the chances are that I will be protected at least for a few months from getting infected. So it's all it's a percentages thing. I mean, it's like the percentages of being hurt by the vaccine are tiny. and the percentages of getting some protection of it are pretty good, at least for a few months. So we're looking at the fall season, getting into like Thanksgiving and Christmas and Hanukkah or whatever, where people are traveling, seeing maybe elderly relatives, etc. It seems like a low risk thing to do, even though, there are no guarantees about it. And I think the communicators on this, whether it's journalists or the government or scientists, need to be totally straight about that.
Mm-hmm. And then also kind of touch on this a little bit, and even into the last piece of information you gave us, there is a difference between getting infected and getting sick. Because there was two things that are not one and the same. You can be infected and go around and infect other people and never get sick. Can you talk about that a little bit?
That's true. Yeah, I mean that's true. This virus. This virus is very strange in that it's not the only one like this, but it's kind of unusual in that you can be asymptomatic and carrying it and it's spreading it, like typhoid Mary and back in the day. But it's and so that's also possible. It's just that I think it's less likely that if you're that if you are infected to a degree that you're not transmitting, that you're not ill, it's also likely you won't be as good a transmitter of the disease. For one thing, you have no symptoms. You're not going to be coughing. You're not going to be sneezing. So those are two really good ways of spreading viruses.
Yeah, definitely. What was the biggest thing that you most profound thing I should say that you learned from writing this particular article?
Well, I mean, it's surprising to me to talk to. There are definitely vaccine experts out there who felt somewhat didn't want to just give a blank check and say everybody should get this, but still voted, like on this panel, voted in favor of universal recommendation for the reasons I explained, that it just so that anybody who wants it can get it. I mean, I'm sort of I find it sort of I was a little surprised though that basically even at this point in time where there's so much distrust of the government, there's so much polarization, this panel of scientists who are independent scientists, they just came through and said what they thought was the right decision, even knowing that half of the population out there, I guess, is just going to ignore them or say that they're all, liars or, in the pocket of the drug industry. So I think that's kind of brave to just, come out and say what you think is right and that you think is the best move to protect population. And, I guess as somebody who's written about vaccines for more than 20 years, I think that the vaccine makers and the people who study vaccines and give expert opinions about them are a fairly reliable group.
Now, in your research, did you come across some information about what are the doctors saying that how long you should wait if you've already been sick or if you've already just had a vaccine?
Yeah, they're saying 2 months, after being ill is probably good. And definitely after getting vaccinated, you wouldn't want to get one more than, less than 2 months afterwards. So those are basic things. I mean, personally, I got sick last spring. I was in no hurry to get another one. And I even was on the fence about this one. But then I thought it can't hurt. Nobody else is going to I'm not taking it away from somebody else. Mm-hmm. It's not going to hurt. And maybe I'll get a few more months, of protection. And maybe I'll get sick again next year, But at least for the period where I've been vaccinated, I won't be getting sick or giving it to somebody else, probably.
Or possibly, hopefully. I got sick was it this year? Last year I got sick, same thing. I got the vaccine, got sick. I didn't get the third shot yet. Right before I was getting ready to get the third shot is when I got sick, but it wasn't as bad as I expected it to be. And that could have been because of the vaccine, I'm in that high risk category, so, I figured, what's the better, be safe than sorry. I have lost a lot of friends to COVID. I had lost. 2020 was a rough year for me. It was just a lot of people that I knew that I had no clue that they were susceptible to something like this. Just were there one day, and 2 weeks later they were gone.
Right. No, I mean, those bad old days, we definitely don't want that coming back. And it's still, I mean, there are people still dying. I mean, they're not as visible. It's not like the hospitals are overrun with people, and most of them are elderly people who are the kind of people, I mean, the sort of groups of people who often, like, will die of flu or RSV, some infectious diseases, like the thing that kind of finishes them off. I mean, if they're ill, very chronically ill and so on. But even so, I mean, that could be a tragedy. And then the deaths of younger people are even worse. So,
So,
but yeah, I think I do feel like what you're saying, that we all feel a little bit there was that initial excitement about the vaccine for most of the country, at the end of 2020. And then, it just didn't quite pan out the way we wanted. But I guess, don't let the perfect be the enemy of the good, or whatever is applicable here. It's probably worth getting it.
Now, one thing I want to mention to our audience is that we don't give medical advice on this show. So if you're considering taking this vaccine, our audience listening, or people watching on YouTube and on Facebook, WVON audience in Chicago here, talk to your doctor who knows your body the best. We do not give medical advice. Don't get a vaccine because I said do it, or don't get a vaccine, or not get a vaccine because I said do it or not do it, or anybody on radio,
or because I said it,
or anybody said it. Because the sad part about it is that why do you think for that reason? Why do you think there's so much misinformation out there? What are some of the root causes? As someone who's actually done the research and actually looked at the facts and looked at both, all the things you can possibly do, and you've been doing this for the last 20 years, why are some of this how is so much misinformation going on about the vaccine?
Well, I mean, first, because I think there's a number of reasons. One, like, vaccines are just kind of a scary idea because you're healthy when you get them, and it's like getting any kind of medical procedure, I think, has a certain amount of risk and seems a little risky, and especially if you're not ill. I mean, people who have cancer will undergo the most horrible treatment, right? Chemo, be nauseous or have their hair fall out, but they're doing it because they're sick. So with vaccines, you're not sick. You're being told this is going to prevent you from getting sick, probably, a certain percentage of effectiveness. So that right there is a little hard. I think it's hard for anybody just as a human to sort of totally accept. And then, there were some side effects from this vaccine. The first series of shots, younger people in the age group of like teenagers to 30, about 1 in 50,000 had this myocarditis reaction where the heart, inflammation of heart tissues, and apparently almost all of those cases, resolved without any, long-term effects. But still, it's very frightening. A lot of people were hospitalized with that. So that's really scary. And 1 in 50,000 is not very many, but if it happens to you, if it happens to your kid, that's totally real. And then there were some other, things that were rare with some of the other vaccines that happened. People had allergic reactions to some of these vaccines, pretty rare also, but that happened. And then there are a few things like that happen after you were vaccinated that probably have nothing to do with the vaccine, but they maybe happened within a week or two after. And then there are really a lot of people out there who are using this for political reasons, I think, to sort of teaming up the vaccine skepticism with skepticism of the government in general. And there are people who make money off of saying vaccines don't work, use this vitamin instead, use this. I mean, seriously, you can't underestimate that.
We got to end it there. So that was good information. I appreciate you. Arthur Allen written an article with KFF News, the news article, why the CDC has recommended the new COVID booster for all. Thanks for your time. Got to be back.
Thank you.
Look forward to your next article.
Thank you so much.
This is America's Heroes Group. We'll be right back.